Hi, so today we are going to discuss what is a thermal care, right? So, hypothermia. Hypothermia is a more dangerous in a preterm baby. So, hypothermia means low body temperature. That is a hypothermia, which is a very dangerous or more dangerous in a preterm babies. Due to what? Due to the less amount of the breakdown of fat in the body. Due to the less amount of fat will be breakdown in the body. So, it is a very harmful or dangerous for the whom preterm babies. It is a very harm or dangerous, right? Such babies suffer from sequel of the hypothermia like a hypoglycemia, neonatal convulsions, and sepsis, etc. things. So these baby are more prone to hypoglycemia, convulsions, and sepsis, etc. things. So thermal care is a very important in whom the preterm babies, this is a very important, right? So next we will see what is a KMC, that is a kangaroo mother care. So we will see what is a KMC. So kangaroo mother care, what is a kangaroo mother care? One should keep the preterm newborn in between the breast of the mother with direct skin to skin contact, follow with what? Wrapping the baby's position by position of the baby should be with the forelimbs semi-flexed, or with the one side rotation of the neck and eye facing towards the mother. So here what happens? So we have to keep baby in a touch with the baby. Most important is here touch. So we have to keep mother and baby touch together, skin to skin contact. For what? To increase, they have given advantages of it. So what is the advantages of the kangaroo mother or giving up or touch, skin to skin contact with the baby and mother? So what it will be do? So it increases the infant mother bonding, it increases the bonding between mother and the infant. Next is what it does: increase and stimulates the maternal milk secretion. Why? Because the happy hormone will be produced in the body of the mother, right? So it increases the milk secretions in the mother. Next is what? Next direct skin to skin contact provides balanced heat to the body. So it will provide the newborn baby to the balanced heat from mother. So we have so normal without increased body temperature, mother content nearly we have normal body temperature. So that could be get contact with the baby and get balanced body touch or heat of the body, right? So it will happens there. Next is what is the next advantage? Protects the baby from the infection. It will also protect the baby from infection, and the baby gets immunized with maternal skin and microorganism. So it could be not cause any types of a harm to the baby due to the touch of the mother. So it get immunized throughout the touch, right? So they have provided the image. So in this position we have to keep the baby near the mother, and it could beneficial for the child as well as the mother, right? So this is the image. So next we will see nutritional care. They have given a little explanation regarding nutritional care. We will see what is the nutritional care, right? So we will see that what is a nutritional care. So here exclusive breastfeeding is the only recommended from the nutrition for the newborn. Exclusive, it is very important, or only recommended nutrition for the newborn. For the newborn it is a one and only option for the growth and development of the baby is a only breastfeeding is a only one option and recommended form, right? So supplementary feeds such as animal milk including cow, buffalo, goat milk traditionally recommended in the various culture across the Bharat. We have different culture and a kind of animals will be provided. According to that, some gives milk to the baby of some provides milk of a cow, some gives milk of what, buffalo's milk, some provide, right? So kind of a, according to the not accordingly, but according different animals milk will be provided to the child, right? So next page we will see a process described in Ayurvedic text. One such prepare according to that part we have to prepare. What we have to prepare? We have to prepare the Kshirapaka, where animal milk is medicated with the Laghu Panchamula herbs. We have to provide or make a pak of that with what medicated with Laghu Panchamula herbs, including Shalaparni, Prishnaparni, Brihati, Kantakari, Gokshura, etc. Ingredients will be added to that milk and making a Kshirapak of that milk. So it could be beneficial to the baby, right? So in cases where the maternal milk is insufficient or unavailable, that time we will provide the formulations of the milk and we will provide that milk to the baby, so growth and development of the baby will be easily done without any harmful infections with the directly giving milk of the other animals, right? So they have given, maybe given the following evaluations of the maternal breast milk secretion. The adoption or promotion of the baby friendly hospital initiated by the institute and hospitals provide vital encouraging breastfeeding and improving neonatal healthcare, etc. things they have given, right? So next point we will see what they have provided. They have given applied pearls, etc. You just read it out, you will able to understand, right? So now the advantages. What are the advantages, advances in what has been advanced in the neonatal care, we will see. So what has been advanced in neonatal care? So advances in neonatology have been transformed the care of the premature and critical illness newborns, significantly improving what? Improving the survival rates and long-term outcome, etc. things has been improved in a newborn babies or neonatal care. So now the premature deaths are decreased, not as of before. So the ratio of the newborn dies due to the nutrition or less nutrition or any other complications, has the ratio has been decreased. So next they says that innovations such as non-invasive ventilations techniques, high frequency jet ventilation, etc. for the respiratory purpose has been advances in the neonatal care, right? Advanced incubatory technologies and refined surfactant therapies, etc. has been increased for the respiratory support for the neonate. I just read it out and you will be able to understand, right? So a judicious use of the surfactant steroids positive pressure ventilation technique is useful to take over the lethal neonatal conditions. RDS, EMAS, aspirational pneumonia, etc. things will be now become easy to treatable, right? So this is a not as much important chart. We will move to the next page. So here is a very important Ayurvedic explanation has been given regarding what kinds of complications will happen if we will cut the umbilical cord in improper form, or which has not to be done during our kind of things we have to not done during the cutting the umbilicus, right? So what kinds of problems will be happen if nabhi has been curtain improperly? So they have provided Asamyaka Nabhinala Kartana Janyavadi, etc. has been given this. So the explanation they have given, we will you just read it out the shloka. I will explain what they have provided in the shloka. So this says that improper cutting of the umbilical cord gives rise to what the different types of complications, like what happens if the umbilical cord is not cutting properly or get infected. What will happen? The umbilical sepsis will be happens, omphalocele, umbilical hernia, fasciculitis, and umbilical discharge, etc. things will, or complications will be developed if the umbilical is cut in improper form. So what we'll see happens, we will see one by one. So first this is so first is a utundika, that is everted or improper cutted, or like a cross line cutting, that is everted umbilicus. Next is a vinamika. Here what happens, the elevated in a peripheral and depression in the center. Other side, peripheral side, that is round side, is a elevated or upper side, and next center is a depressed, so that is a vinamika. Next is the vijrumbika means what? Increase in diameter of the umbilicus. So here what happens, the diameter of the umbilicus will get increased, right? So next is the pindika means what? Swelling around the umbilicus. Around the umbilicus there will be presence of the swelling or increase in the swelling. Next is ayama, that is increase in the cord's length. So we have to cut in a proper length, not increase in a length. So ayama has been given regarding increased in a cord's length. Sixth is vyayama, that is what? Dimension of the umbilical cord. These are the six conditions: Uttandika, Vinamika, Vijrumbika, Pindalika, Ayamani, Vayam. Six things are given regarding a Samyak Nabhinal Kartanjanya Vyadhi. So, if cutted or the Nabi get cut accordingly, this, so definitely the kinds of Vyadhi will be produced. So the next is, if the kind of problem has been already done, or we have cutted the umbilicus in improper form. So what kind of a treatment we have to provide to the baby? So, or what we have to do, right? So what kind of chikitsa we will provide? So we will see now the chikitsa. So what kind of a chikitsa we have to provide? So first, all these diseases are treated with abhyanga. First of all, we have to provide the abhyanga, because all these kinds of diseases get cured with, or cured the diseases accordingly by abhyanga. Next is a utsadana, that is a powder massage. Utsadana, we know that. Powder massage, right? So next is a parishek of a ghrita. We have to like a sprinkling the medicated ghee, right, with avidahi, vata pitta shamaka dravya, etc. we have to use. So what they explain, nabhi is the pitta sthan. We know that nabhi is a pitta sthan, and prabhava sthan of all shira as well as the dhamani and nabhinal kartan is one kind of the abhighat. At the marma, at the place of a marma, some kind of abhighat or shastra karma will be done, and if it get improperly done, it definitely going to aggravate the vata dosha or other kinds of dosha present there, right? So therefore, after the nabhinal kartan, there is a vata pitta prakopa and rakta dushti. Here most importantly, vata and pitta get prakopa in the prakopa avastha, and rakta dushti will be happen here. So important. So the process of nabhi parishechana or nabhi abhyanga with the tail reduces the aggravated vata and rakta pitta dushti. So very important, or uh, most importantly, they have given the importance to the nabhi, for what they have given nabhi abhyanga, or importance they have given to the abhyanga, right? Next they says, dravya used to prepare oil are rakta pitta prasadana. So the kinds of dravya we have to use, those dravya which are rakta pitta prasadana and vata shamaka dravyas, because the here increase in vata due to shastra karma kriya, while procedure of abhyanga and parisheka is soothing in a nature, so newborn can easily tolerate it and feel relief from the pain. This kind of a procedure has to be soothing. Why? Because the newborn can easily tolerate it and feel relief from the pain, right? So this is the chikitsa given regarding nabhinal kartan. If get improperly done, so the kind of a chikitsa we have to provide. So this next they say that, so different pathological conditions of the umbilical cord and umbilicus are as follow. The what kinds of complications will happen, right? So we will see what kind of complication. First this is that umbilical sepsis will be happen. So we will see what is the umbilical sepsis. This is that if the instrument used for the cutting umbilical cord is not sterile. Why sepsis will be happen? Sepsis means the kind of a discharge or around like a pupil like a thing like this, something will be happen and a discharge will be present, right? So that will be called as sepsis. So why it will happens to the baby? Why it will happens? Because of the non-sterile object we are used for cutting of the umbilicus, right? So sepsis will be happens. So next this is, what are the sign and symptoms for that? So we will see what sign and symptoms will be seen there. So first is sign and symptom according, red around the umbilicus. Around the umbilicus there is a presence of the redness. Next is a discharge, pus or a blood stain among the oozing umbilicus. Tenderness, tightness, kind of a painful cry of the baby when it or we will touch the umbilicus of the baby. So the pain will be present and tenderness will be present. In cases adhesion of, for the umbilical cord are observed, some kind of adhesions will be present there, right? So what will be the treatment for sepsis? Cleaning the umbilical cord, and this is first of all we have to clean the umbilical cord, right? and para-umbilical skin with the antiseptic lotions, that is a chlorhexidine and Dettol. We have to clean that. First treatment is cleaning. We have to, first of all, we have to clean the clean the place, right? We have to clean the place with what? Antiseptic lotions, and that is a chlorhexidine and Dettol we can use, or betadine etc we can use there, right? Betadine also get used, betadine also used, right? So use of a local antigen. Next this is in a treatment, use local antimicrobial agents, use of the antiseptic antimicrobial agent, that is a antibiotic etc things, or antimicrobial agents. We will use some kind of antiseptic lotions we use, including what? Povidine lotions, iodine, that is a betadine powder etc we will use local antibiotic solutions etc we will use, which are cover the or kill the bacteria which is present outside the body, right? So local antibiotic solutions also used. Ointment are helpful for the controlling the infections, also ointment we will also use. Next, the hygroscopic powders etc will be used. Hygroscopic powder means what? Scopic means the thing which absorbs, right? So the so it will able to absorb the substance at there, absorption, right? So it will absorb the kind of a presence of the water or etc things we will get absorbed through hygroscopic powders. With what? Antimicrobial properties are also used. Next, this is in treatment, systemic antibiotic also may needed in the case of a systemic symptoms like a fever, irritability, refuse to, if the baby is refused to feed etc things will be present, or systemic antibiotics also we have to use, right? So next, they have given regarding clinical questions or what kind of what we have to take, right? So we will see yeah, it is an what is a omphalocele? What is a omphalocele? First we will see what is the omphalocele, right? So what is the omphalocele? That is an incomplete union of the rectus abdominis muscle during the growth until age of 3. There is a not incomplete union of what? Rectus abdominis, which is present on the near line of the stomach, right? During the growth up until the age of a 3 or a 5. So here the improper development of the rectus muscle will be present. So that is mainly we will say that that is a omphalocele. Result in omphalocele and omentum herniations will be present of the herniation from the umbilicus, right? Here two most important thing, rectus abdominis and herniation are the two terms here we have to keep in mind, right? So what kind of a sign, so what is the sign and symptom we will see? First is a soft reducible swelling over the abdomen, generally subside by age of 2 to 3 years, right? Generally self-limiting and no complications will be occurred in omphalocele. So we have seen or we will able to see some children has their upper or swollen belly button till 2 to 4 years of age, right? So that is they says that there will be no development of the any complications occurred in omphalocele, right? So next is umbilical hernia. Umbilical hernia, whenever content of the abdomen like omentum intestine comes out from umbilicus. So umbilical hernia means what? Internal contents will be come out throughout the umbilicus. So it is a reducible, but sometimes it is a non-reducible swelling. So in a general hernia we know that the internal intestinal line comes into the scrotum. So here what? The hernia is a abdominal content comes throughout the umbilicus. So umbilical hernia, easy, right? So what kind of treatment we have to provide? So omphalocele has no treatment required. It is the most of the cases omphalocele has not required any kind of a treatment, but while any or other umbilical or in complications may require, right? So while in umbilical hernia we know hernia is a non so we know that hernia, it is a surgical procedure. We have to cut down and take the intestinal wall in the upper layer or inside the abdomen and give the suturing to that. So here also we have to surgical correction we have to done. Next this is as umbilical adhesion. So what is umbilical adhesion? There is a high risk of the umbilical eversion, everted umbilicus or omphalocele when the umbilical cord is not removed from the umbilicus and remain attached. So that is adhesion. Here is a attachment of the umbilicus cord and not properly removed, right? So that is umbilical adhesion. So all the kind of umbilical eversion, everted umbilicus, omphalocele etc things will happens if the umbilicus has not been removed properly, right? So these are the things which have to keep in mind. So in the next video we will see they have given regarding preterm and neonatal etc thing. So we will discuss in a next video, right? So thank you.